All right.
Hello, this is the Surviving Healthcare Podcast, and I've got Deb Lambert here, who's my new best friend who knows everything about these corrupt radiologists who I just wrote about. And she contacted me after. She claims that I contacted her, but I think she contacted me. And she's a Facebook administrator for a 15,000 gadolinium Facebook group, gadolinium injured Facebook group. And so, Deb, tell me the story about your experiences and how you came to launch your Facebook group and your experiences and what progress you're making.
Well, thank you, Robert. Thanks for having me. And it's nice to see you face to face. I was so excited when you released your podcast and I listened to it. I made me want to cry because I was like, this guy did his homework. He's got a lot of factual data here, and this needs to go out. And so I shared it around all the the support groups that I'm involved in and the platforms and everything. But I'm Debbie Lambert and I am a patient. I'm not a doctor and I'm not giving medical advice. So please follow up with your own doctor when you're deciding what to inject into your body because it is your body and everything has an impact. We're holistic beings and everything has an impact. So you need to know what you're putting in your body and what some of the risks are. And I think that's what launched my passion and purpose for this was that gadolinium. When I was injured, I got 4 injections between 2016. I've written a book and it's all covered in the book. And the book has 24 other patients' stories in it. And we really are just sharing and trying to humanize this plight. And we get several hundred new patients every month, and we're just one support group of several worldwide. And it is problematic. And the biggest problem that I think patients have is that they didn't get any informed consent. No one will use the word gadolinium out loud, and that is even true today. And that was 2016, and here we are, what, 2026, and daily we hear from people all the time. My doctor's sending me for an MRI with contrast, and what's the contrast? And we tell them, it's gadolinium, or they've heard the word gadolinium, and then they start researching it and they hear these horror stories and they're like, I don't know what to do. They told me they can't see it if I don't do it. And we're like, well, a good rad tech, there are instances it needs to be used and you have to decide because it's your body, but informed
I
consent,
dispute that.
right?
I
Yeah.
dispute that. I think it's so toxic it should never be used. And I think in 95% of the cases, the images are within 10% as good if you don't use gadolinium as if you do use gadolinium from my research, roughly.
Well, and we do have a lot of patients who, we have two groups that come to us, right? We have the patient who is being sent for imaging and isn't sure and has questions and doesn't feel like they're getting the um, truth and transparency
Yeah,
from
they
their
feel like they're getting
doctors.
lied to.
Yeah, they're not getting truth and transparency and honesty from their doctors. So they're
I don't
looking,
know
and
how
we've
you
all
can
learned a
maintain
lot
your
from the
respect.
pandemic.
I don't know how you can maintain your respect for those doctors, Deb.
Well,
I call a spade a spade.
well,
If they're lying turds, I call them lying turds, and that's what
and
these
there's a lot of
radiologists
people
are.
who will agree with you, right? And
Right.
I'm of the mindset that um, we all make bad decisions and people go to medical school for a lot of the right reasons. You're a doctor, you went to medical school to help people. And it's unfortunate that corporate medicine at the highest level is probably where some of the disconnect starts to happen. And then you learn from schools the dialogues and we're taught different things. And even as patients, we're taught to trust the medical system and they know best and all that. But that doesn't hold any water anymore in our current state, right? And the world is in discord trying to figure it out as we unravel what did we know that isn't accurate or has changed and how do we reconcile it. So I don't want to ever pick on one group or another because I think they all have their faults. I get contacted from radiology techs all the time that are like, we do inject it too often and we're just told to do our job and we can't really push back, and we do give them a form and the patient does sign it. And I'm like, well, does the form say this is toxic? It is retained in your brain, your bones, your tissue, and your organs. Does it say that on the form? Well, no, it says we're injecting a contrast dye. Well, that doesn't tell a patient anything really, right? I mean, you sign a form that says it's a contrast dye. We don't really have a lot of diagnoses. And true, the only real formal diagnosis to date is NSF, which is nephrogenic systemic fibrosis, which was known about in 1997. Since then, they've changed the ligands, which is the wrapper that goes around the gadolinium to keep it safe. But in every instance, we see problems. Problems are reported to the FARS database, FAERS, and there's reporting. I mean, we can go on to lots of different pathways, but I think informed consent's a big one. And then when problems arise, people don't know where to report it. Their doctors want to, they say, let's take a wait and see approach. Or if a doctor does know and has learned that it is retained, they say, well, we can't fix that right now. So let's just deal with your current symptoms, right? So then you have new symptoms, worsening symptoms, unexpected, unexplainable issues. And you're like, how did I get here? And that was my case. I got so sick and I lost my memory. I've told this story a million times. I lived in the same hometown and I couldn't find my way to work. I couldn't find my way to the grocery store, the dog park. And so then I got a second injection to test for Alzheimer's, which just, increased the body burden. So it's really about body burden and toxins. And we're, we're living in a toxic world. I still have friends who say, just pull up your big girl panties and get on with life. But imaging continues to show that every organ in my body has got a problem. I just got new reports back this week about my liver, and my liver's got massive problems. And that changed from imaging that was just less than 6 months ago. So heavy metals are not our friend is the message. And I just want people to be educated, be aware, know what you're putting in your body,
So
right?
there is a way out for you, and that's NBMI, which you probably know about, right? And it's the
Right.
only trouble with it is the damn stuff costs $500 a month right now. And I don't think it's going to be like that in 3 years, but for now, you should get some of it, even if you only have, even if only you can afford a couple of months worth. That will bind your, I want to say mercury, but the gadolinium is very similar. And as far as I can tell, these bastards are sticking something with a organic wrapper around it that's essentially identical clinically to mercury. I mean, the stuff is very toxic, should
Well,
never be
we
used for anything. And
well,
the
we
advantage in the imaging is minimal, if at all. It's a very small advantage.
it does make your body glow in the dark. It makes a pretty good image. It does. But I mean,
You're
the
just so
radium girls
sanguine. You're
the
sanguine
radium
about
girls
what's
are
been done to you.
the radium
What they
girls are
did,
buried underground and they're still glowing in the dark. So glow in the dark isn't all it's cracked up to be.
what they did
And
is
I'm not saying that's what gadolinium does. I'm not
they
saying that.
took a revolver with one live shell in it, spun it, and pulled the freaking trigger, and you got shot in the head. That's what happened. And you're complaining that you didn't get informed consent that they wanted to kill you. I mean, if what they should say is that there's no real good reason for this for anyone, and we're going to use it because it's profitable, and you're going to suffer the consequences, and you're not going to be able to do anything. That's the real informed consent.
Well, and I think there is some truth to um, the repeat customer model, right? Because you get sick and then you go back to the doctor and then it's more tests and more whatever, or and it just continues to continue to feed the model. And that in itself is problematic. So, yeah, we're in a quandary and a kerfuffle that we've got to fix. And I want to be part of the solution. So I never want to, I think everyone deserves a seat at the table. I think there's a whole group of doctors who don't have a seat at the table, and that's functional medicine, right? Functional medicine, natural products that have been cut out from the conversation, and patients aren't being listened to. We're gaslit. We're told, 80. I just we did a study in one of the support groups. 86% of the people said they were uh, they were told it's psychosomatic.
The doctors are not the primary problem. I mean, I'm talking as
No,
if they're the evil
they're
empire,
not.
and they're not. I mean,
No.
the industry is a multi-billion-dollar industry that poisons people with this stuff, and their business model is when they injure people, the people come back for more medical quote treatment.
And that's a what do you call that? That's a way of life or a dichotomy that we've bought into and we've learned, and it's a behavior that we've learned, and we buy insurance and da 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 da, and all that's changing. And as traumatic and horrifying as the pandemic was and continues to be, and things are unfolding, we can kind of thank the pandemic for bringing unraveling and opening the door to shed new light into that we have to make some changes because these agents and these drugs, these synthetics and heavy metals and even plastics. Remember the times when we talked about paper? Paper was no longer good, so we moved to plastic. Well, now everyone's got plastic in their bodies, whether
I
it's
don't think that plastic's a problem. And I analyze this. Plastic's another psyop. Plastic is a very small problem and it's more of a psychological war against us than anything else. And I've got a post written about that if you just search my archives for plastic. So
okay.
I don't
Yeah,
believe that story.
okay.
But you're such a nice person, Deb. You can't
Well,
believe
yeah, I
evil
mean,
of anybody.
I want to be part of the solution, and I don't think you I can do that if I make enemies along the way. My goal is not to make enemies. My goal is to get everyone around the table, having open and honest dialogue and talking about what we know today and not what we knew back in 2016 because a lot or 2008 because a lot of people there's 46,000 PubMed articles out on PubMed, which is part of the National Library of Science of Medicine, right? I probably didn't say that right. But there's 46,000 articles written about gadolinium. But what the articles they wrote in 2018 and the articles we have in 2023, 2022 are very different. I mean, 1997, they talked about NSF and nephrogenic systemic fibrosis, and that was only if you had bad kidneys. Well, that has been disproven. It doesn't, kidneys are an important part. I'm not discounting your kidney function, but they don't even test. They took that out of the American College of Radiology manual, and they don't even make them test anymore for some brands of the contrast to see what your kidney function is because they've discounted it and they know that kidney function doesn't doesn't fit the dialogue that it did in 1997. So we've evolved. And so my message is let's all evolve together and let's read the current research that's come out in 2022, 23, 24, 25. It's very different and we know so much more. We now know that it upsets the mitochondria, right? It it impacts the immune system, cytokine storms, the red blood cells, the bone marrow. It's found in
Yeah,
the
that's a
bone
lot of
marrow.
abstraction. What you want to say is they knew how bad it was in 2018. Then they covered it up, and since then the whole thing's been completely transparent, and their crimes are revealed for all to see. And they're hesitant to even talk about it now because they know they're going to get their heads chopped off soon. That's my opinion. And
Well,
you told me how they're reticent to even talk about it now, the radiologists.
no, and they don't talk about it. They won't talk to patients about it, and that and they've started to use it for other things. Right now, they use it for mammograms. They didn't use it for mammograms 10 years ago, but now they're using it for mammograms. And when you're injecting a toxic rare earth metal that is proven to be retained in the brain, the bones, the tissue, and the organs,
Indefinitely.
in up to indefinitely. I'm 8 years out. I still have high levels in my urine, my hair, my fingernails, and my blood serum. And the blood serum was a surprise to some of the doctors because typically leads don't stay in the blood that long, and that's unprovoked. And it's at high levels in my blood serum still. So, and I'm not just the only one. If I was the only one, that would be okay, right? Because we expect bad things to happen sometimes. But
You're such a nice person.
there's just
I'm an angry animal. You know what? They Captain America in one of those Avengers movies said, "It's time for you to get angry now, Bruce Banner." And Bruce said, "It's my secret. I'm angry all the time."
oh, well, you can
So
be
that's what I
angry.
am.
You can
I'm
be
angry.
angry and still be kind, right? Or
Yeah.
I don't know. It's just it is hard. It's I just don't want to be angry because it doesn't make me feel good. So I
These
just choose,
guys took something that was as toxic or almost as toxic as mercury, wrapped it loosely in an organic molecule, and then started using it on patients.
yeah,
The radiologists and the researchers from the big companies that put this thing together. And
yeah.
they've known how bad it is from the start. It should never be used. The entire thing should dissolve in a maelstrom of litigation. But
And I could hook you up with so many people in my group, and it's not my group, it's the group that I belong to. And there's lots of admins in our group, and they all are doing great jobs of helping people get educated and, chelation. We're using chelation. You mentioned one product. There are multiple products. I mean, the
there's
most
nothing
common
like
product is
NBMI.
DTP.
NBMI is a very strong covalent um, binder that will take this material, this metal, and render it absolutely inactive. It does not remove it from the body. That's impossible. You can't get this stuff out of your body any more than you can get mercury out of your body. And I've had 18 months. I have severe mercury poisoning from a mercury amalgam. 17 mercury amalgams I had when since I was a kid. They filled in a few crevices in my teeth, and I mean my mercury levels, according to some testing, are off the charts, but it's all inactive because of the NBMI, Boyd Haley's compound. So anybody that's interested in that should look at my Substack, robertyoho.substack.com, and search for NBMI and read those posts and contact David Kennedy.
And I will share that in our group.
Okay.
I will share it because we're an education and a research group. We're a support group. People come. They either, like I said, two different groups. So they come because they're being sent for it and they're wondering what it's all about. We educate them. We provide them with factual data that are published research documents so that we're not giving medical advice or getting ourselves in trouble. We're sharing accurate data. And then people have to make their own informed decisions. And then there are the people who come and they're like so sick, right? And I've told this story before, but I belong to a lot of different groups, and my doctor was having me look at a old drug, and to try and help me. And she said, just go to their group and see what you can learn and just be curious. So I went out and I was talking about it and I was asking questions. It's a cancer group, and they have 150,000 people and they're using these products. And so I went out and I was asking around, and people are saying, well, why are you asking? I said, well, I'm gadolinium heavy metal poison patient. And people are like, well, what is that? And I'm telling them. And then light bulbs are going off everywhere, right?
Because they all had gadolinium and MRIs.
Right. Yeah. Because they're being treated for cancer. They thought the symptoms that they were experiencing were from the cancer
Yeah,
drugs. But then they heard about gadolinium, and then they saw the list of symptoms that I shared with them that come from the medication guides, by the way. And they're like, oh, holy heck. I think I don't think that my problem is as much my cancer as it might be this heavy metal, right? And so the light bulbs go off and a whole new dialogue starts, right? And we had like 100 patients jump from the one cancer group into our group in 3 days saying, what the heck is going on here? So it is a problem, and we know it's a problem. We know it will all come to fruition in God's timing. And I believe that. As a Christian, I believe that. It's all going to come out. Nothing will be hidden. So it's timing. Part of it's timing. And but to your point, I mean, we have to use chelators. We have to figure out a way to get it out. I'm not an expert. I'm not good with chemistry. I don't understand how and that's part of the dialogue that's going on between the researchers now, because we have a great doctor. Dr. Richard Samalka has given up his whole second half of his career just to focus on heavy metal chelation. He's just has a brand new book out. Um, you can look it up. I can't remember the name. It has to do with, um, oh,
well, there's nothing else that works like NBMI, and I don't make I don't make any money on it. Nobody makes money on what I do, but uh, this stuff binds it irreversibly and completely inactivates it. Other chelating agents capture heavy metals and carry them around the body, and sometimes deposit them in the kidneys and freaking kill you. So
Well, and
I,
that is, I mean, that's a concern, right? That's where I tell people gadolinium is not a DIY project. If you're sick from gadolinium, it's not a DIY project. You need to be seeking the experts. You need to be talking to people who know how to get
let
these
me tell you
metals
what I
out.
did. I flew out to Kentucky to spend an afternoon with Boyd Haley, who RFK Jr. characterizes as the top mercury toxicity expert in the world. And this stuff that he came up with, in theory, it nails and chelates all heavy metals avidly, like lead. The studies are, he has $100 million worth of studies on mercury, but it's, there are anecdotes about gadolinium, which are very strong. People got over all their symptoms after, a month's worth of doses. So, I mean,
Yeah,
this,
I mean, I'm definitely going to check it out. I appreciate the
yeah,
heads
yeah.
up, and I am for sure going to check it out. And I'll share the article that you mentioned with the community. And we just tell people, do your homework. Don't, like do your homework. You got in this mess because you trusted someone. And so you need to be aware and you need to take ownership for what you're putting in your body. And yes, chelation has been around forever. The military uses it, right? And we have a hard time getting the DTPA because the military uses it for the military. And so we find sometimes that people who want to do the DTPA, which is one other chelator, and maybe we should talk about chelators for a minute to the audience, and that is that each chelator has its own stability and its own um, uh, binding capabilities, right? And are specific sometimes to different metals. And so if you have a binder that's not strong enough and it grabs onto the metal, but it can't escort it all the way out, it will redistribute. It will get lost and it'll move around and it'll have to find another molecule to marry in the body because that's what it does, right? These heavy metals, like other molecules, one of the radiologists refers to as that they dance around on the dance floor, find another molecule, and off they go to be hidden somewhere or settle or whatever. But those are conversations that we have to have.
I'm no chemist,
Yeah,
Deb,
me. And
but
I'm not.
I interview people, and I spent 2 days interviewing Boyd Haley and David Kennedy, who are the two principals left in the
Watch that.
OSR, in the NBMI group, and I believe them because I can tell who they are, and what they were telling me is
Well, and
true.
if it works for lead and it works for mercury, I mean,
Yeah.
there we have a great researcher that I won't mention the name, but this researcher's done a lot of work and mapped gadolinium to lead, the same pathways as lead. And so if they're using these products for lead, why wouldn't they work? I think part of the conversation I did chelation for a
Works for
year.
iron too.
And I did chelation for a year and it really helped me. There's new research out that says chelation can be dangerous. And yes, I think part of that conversation still has to evolve because if it's inert, if the have and I'm not an expert, I'm not giving advice. I'm just trying to have an open dialogue, right? But if the metals get intercellular, then how do they get out? Unless the cell dies and breaks open and then it's free or moving around again, right? And then it's able to be captured. I don't know. I'm not a chemist, but there's a lot of dialogue that's misunderstood. And so I think for me and my passion and what I hope to evolve this conversation globally is that we have to have transparency. We need education. We're living in a toxic world where toxins are just running rampant. We need, as humans, to change the education system so that we're talking and educating people to live in the real world where you're going to, run into really bad things.
Yeah, this is terrible. Deb, you understand what these bastards did to begin with gadolinium. They took it with an intermediate strength chelator and bound it to this intermediate strength chelator, and that supposedly protected it from the human body and allowed excretion. But NBMI is a 10,000 or 100,000 times as strong. And when that gets a hold of a mercury or a gadolinium ion, it crushes it and it makes it so it is inactive. Nothing ever happens to that damn thing again. And it's entirely different than the chelator they use to turn this into a quote therapeutic agent or these other chelators that you're quoting as treatment because they just are not strong enough to absolutely kill the activity of the toxin.
And that is a problem. I mean, and that's what makes people sicker, right? People, I've had doctors say to me, well, your kidneys are failing and your liver's failing now, and your heart, I have three new heart diagnoses in the last 6 months. They're saying, well, that's because you did chelation and it didn't work. And I'm like, well, I did get my memory back. I did able to like put two and two together and know that that's four, which I couldn't do the first year. So it did help. Chelation did help me. Did it redistribute? Did it not hold? I mean, I don't. We're in a bad space. This agent has been injected over a half a billion times in the first 3 decades, and it's still being injected. Uh, I think 30 to 50 million times. And don't quote me. I mean, please don't take that as gospel, but tens of millions of times annually. So we're still, and we're finding new reasons to inject it. So, and people, 91% of people said they never got informed consent about what they were putting in their body
Yeah, the
when
reason why
this
they
data
inject
is
it
known
is
about.
the people's money is green. You're such a sweet person.
You're so cute.
I
And
really
I
like
wish
your.
I could, I wish I could. I just can't badmouth anybody because I just want to be focused on figuring out solutions.
Now, let me make my disclaimer. I'm
Okay.
not a licensed physician anymore. I resigned my medical license and I'm not supposed to be giving advice either, but I always give my advice as what I would do if I were you. You get it? So
Yeah.
that's a safe harbor.
Yeah. And I
Um,
will say that. I will say it,
if it
it
were me,
changed
this is
my
what
life.
I would do. So
Yeah. It's my,
anyway,
it has
but
to be
if I
yours.
were you, Deb, I would I would order that OSR tomorrow. I wouldn't stop. I wouldn't pass go. I'd get the darn stuff and start using
And
it.
you were telling me, I think, or you sent me to an article or something that said it is an oral chelator, right?
Yeah, it's
So it
oral,
goes through the
and
digestive tract
I
and
would
gets
take it
into the
with
bloodstream.
DMSO because and that's what I do. The rat studies, see, DMSO helps the penetration throughout the body, and the rat studies injected the NBMI into the abdomen, intraperitoneally in a rat, into the abdomen,
Yeah.
together with the DMSO, which is a solvent, it's a penetrator. So it goes around and it gets everywhere. So even though you may have testing like the Oliga scan, which still shows high gadolinium or lead or mercury levels in my case, the stuff's all bound up after a while. And you got to somehow get the money together and pay for it or beg David Kennedy to give you a discount on the damn stuff. That's what I
So
would do
does
if
it,
I were you.
when it
Just
binds up,
cry
is it
poor.
staying in the body? Is
It
it
stays in the body. You cannot
stays
get
in the
rid
body?
of it. The stuff has a half-life of 30 years, but it's
Oh, we've been
inactive.
told gadolinium has a half-life can be in the body for like 130 some years. So, I
Well,
mean, I don't know how
I
they
don't think
know
there's a
that.
practical difference. I think you're
I don't
well.
know how they know that. But
Yeah.
gadolinium is the coldest metal on Earth, and I find that fascinating that it's the coldest metal on Earth. What are we doing injecting it to the human body, even if it is wrapped in a ligand intended to keep it safe, which we
Well,
know is problematic.
medium strength bonding. The chelation for um, NBMI is 10,000 or 100,000 times as strong. It's just orders of magnitude different, and it locks that stuff up in such a way so you're safe. And if that's indeed your main problem, and it does sound like it for you, I mean, some people respond within a month and feel better.
Yeah, and
So,
I want to be that test case that in 25 years I'm still around and I can say I healed it. I, I because I have imaging. I get imaging once or twice a year to look at the internal organs, and we use ultrasound, right? We don't use any contrast, and we just use ultrasound. And you'd be amazed at the stuff they see. And they talk about, man, your kidneys, oh man, your liver, oh your heart, your echocardiogram showed my heart has hardened. They call it hardened and thickening, and so the flapper that moves goes up and down to move the blood from the heart to the lungs isn't working, and so it's causing problems, right? And then my pulse is so low that
So
I have no.
that valve is not particularly important, and you can do without it altogether. So don't worry about that.
Don't worry about it.
They've
Okay,
got
well,
you.
I'm not planning.
They've got
So
you
it was just,
excited about the mitral valve.
well, okay, so it's the left ventricle, and it's
Now that's the
called,
right ventricle.
no, on my diagnosis is the left ventricle,
Okay, well that's
and
not
it's
good.
HCM, hypertrophic mitochondria or whatever.
Yeah.
I don't even identify with the labels anymore. Isn't that, I mean, that's sad, but they're just labels to me that just means that there's something wrong. But I will tell you that I talked to doctors, cardiologists, and surgeons in two different states, like five different ones, five different cardiologists. And the drug that they offered me is a drug that has a box warning on it that says may induce heart failure.
You just ghost those bastards. You don't want to have anything to do with them.
I
Deb,
said,
just
well, I said that's not going to work for me. I'm sorry. And if the drug, okay, so then I went to the surgeon, then I went from that doctor. The drug was $8,000 a month, but because if I would participate in a study, I could have the drug for free. And that was nice because I'm helping science, right? Um, but then when I talked to the surgeon who wanted to cut me open, fix fix it. And
yeah,
I said, well, how many times have you done this particular surgery? He said, oh, quite a few. I said, what's quite a few? Like hundreds or
three.
dozens? He never would answer my
Oh
question.
yeah, that's right.
And then I said, well, what's the recovery time? And he said, well, you'll be in ICU about 5 days.
Yeah,
And I said,
five
well, I,
weeks.
I said, well,
The only way you can tell
ICU.
they're lying is if they're moving their lips.
You do have a hard on for these people, don't you?
Oh, I hate them. I
But
hate them.
but it is, but my point being, right, is like to go from being heavy metal poisoned where every single organ is impacted to being told, well, here's our solution for that. And the doctor wants to study the new medication that has a box warning.
Yeah.
And then the surgeon who says, well, I can fix it and you don't have to take the medication for the rest of your life. And did the doctor who was ordering the medication tell you that it atrophies your heart? And I'm like, atrophies my heart.
Holy moly.
So if it atrophies my heart, is the drug so smart that it won't atrophy my kidneys or my liver? Because how does it know? Is the drug so smart or is it going to atrophy all my organs? So these are questions that in humanizing these problems that I hope people will take away and start to ask the more critical questions of their medical people, right? Because a lot of times you go in and the doctor tells you and he's the expert and you walk out and you have a script and you're getting a new test or you're getting a drug and you're not asking the questions.
Yeah, the
And when I
doctors all
said
believe what they're saying, even though it's nonsense.
when I said, well, it has a black box warning, or not a black box, but it has a box warning, and it's only been on the market for 2 years. And you're asking me to be a study participant at what cost to me,
It's
right?
called dog lab. And you're the dog, girl.
I'm the dog. I'm the dog. I'm really just a kind, caring person who has been devastated. I'm
See,
out
we're much more
$200,000.
fragile than we think. And to tolerate a big surgery like that, you better have very good odds.
Well, and that's what, yeah. So then after I went to that surgeon, and he said, I can fix it. I haven't done it a lot of times, but I'm pretty sure I know what I'm doing. I'm like, okay, well, that doesn't really make me feel too good. And then he told me it would atrophy. So then my functional medicine doctor sent me to a group of cardiologists who have walked away from allopathic somewhat. They're still
Yeah.
doing a lot of the same things, but they're a little bit more open-minded. And that cardiologist was so kind. He said, Debbie, walk away.
Yeah.
Walk away from the table. He said, we cannot fix what we've done to you. We cannot fix
Good
it.
for him.
And he said, I'm sorry. I'm sorry. I hope you're hearing me. I am sorry. I am apologizing for what has been done to you. And for the first time, I felt heard, other than from my functional medicine doctors. And I've had great doctors, but it patients aren't being heard. They're not being listened to. They're being gaslit. They're being put on psychedelic SSRIs, psychedelic drugs. Um, their families are sending them to mental hospitals. out of safety because they love their family member or their loved one, and their loved one is in so much pain. The bone pain, we did a poll, and 88% of people are living with bone pain. And the bone pain is so excruciating that clothing hurts, wearing clothing hurts your body. Getting in bed and putting a sheet or a blanket on top of you is excruciating. So people aren't sleeping because the bone pain is so intense. And when we did the poll, and these are informal patient polls, we know they're not scientific data, but they're not doing the research. And how does a rat or a mice tell you that it has bone pain? How does it? I mean, they're testing mice, but how does a mouse tell you I have extreme bone pain? Help me.
See, they have enough data to stop the whole program now based on the problems. I mean, it's just outrageous that they're still screwing around with this stuff.
Well,
It's outrageous.
it'll all come. It will, and it'll all come. And my goal is not to poke the bear and make people mad. My goal is to say, let's have open dialogue about this. 88% of people can't sleep. They're being sent and put on other drugs that are synthetics and heavy metals and all kinds of things. And that's not helping them. That's not getting to root cause. That's not getting the metal out like you told about the product that will get metal out or encapsulate it. That's the direction we need to be moving, and we should have everyone at the table. I had recently, I had a internist tell me, "Why are you here?" And I said, "Well, I need partnership. I'm part of this study out of the University of New Mexico, and we're collecting data. And it does have a government grant, and they collect certain data points. They collect your hair, your urine, your blood, your fingernails, and they do a physical. You have to go there in person. They do a physical, and they do all this, and they're collecting data, and then they're collecting all the patients, any information you want to share, biopsies, whatever you want to share, you can, and they put them into this repository. It's actually probably the one of the largest growing patient repositories looking at heavy metals, and it's out of the University of New Mexico Health Sciences. Dr. Brent Wagner, an incredible man, and he's just passionate as I am about let's fix this, and his data shows that the oxalates, there's something to do with oxalates causing problems, vitamin C. And Susan Owens has been studying oxalates for 40 some years. She's a great resource and she's been helping us. So we're trying to get a pool of people together, doctors, researchers, that can, bring this to the forefront because our current medical system is set up that we have the burden of proof.
So, Debbie, do you know what Blue's Clues are?
Isn't that a cartoon?
It's a kids show,
Yeah, kids show. Yeah.
and it's to teach the kids simple things. So let me give you a couple Blue's Clues about this thing.
I really know. I just am different about my approach and how to say things, I
You're
think.
really sweet. But there is a scan that none of these doctors, none of these fabulous doctors you're talking about have ever heard of called an oligoscan, Oligoscan. And that thing is an electronic scan. It's a novel electronic scan that documents your total body metals load and other things, right?
Mhm.
And it's being used now to document aluminum toxicity. And I mean, my Liga scan, it looks terrible because I originally was mercury toxic, and of course, it gave me Parkinson's.
And is it a small, I'm trying to think, is that, who's the doctors or researchers with that?
I don't know, but
Okay.
it's a very quick thing. It takes like few seconds to put on your left palm, and they can get all this data out, and they can tell where you are with all this stuff, and they can document whether you're doing better or not. If you're managing to get some of the metals out,
Okay.
it'll document that. So,
That's a good data point for our audience too, right? To
well,
look.
they can look at that they can look in the archives of my Substack, robertyoho.substack.com, and they can search for oligoscan or scan. And I've written posts about that. And I've got a post coming out about documentation of aluminum toxicity, which is actually a bigger problem than mercury because it's so ubiquitous. Mercury is more toxic. Gadolinium is more toxic, but they're not as common, even though they're common. The aluminum's everywhere. It's rained out of the sky on us. It's on every surface. It's in
Well,
the
and it's
air.
inside, I didn't know it was inside it's inside the tin cans and all kinds of stuff.
Yeah, you've got to
Yeah.
avoid the
Aluminum
cooking
cans.
utensils, and you have to stay away from all vaccines because the new vaccines all contain aluminum instead of mercury. They used to
Well,
con
and there's like just this week alone, they released a lot of studies on aluminum. And so, like I said, everything's going to come to the forefront, right? We're having a come to the table meeting and figure this out. And we have a lot of sick people we got to heal. And so the products that you're talking about help us identify and help us figure out a way to do better,
but
get
if
healthy.
your listeners are interested in the themes that I am talking about, they should subscribe to my Substack at robertyoho.substack.com. And
Okay.
my aluminum post is going to come out pretty soon, in probably
Okay.
2 weeks. And they can
Great.
learn more about that and learn more about the Eliga scan. And
Yeah,
I've,
we'll definitely send people your way. And if you
yeah,
can do the same, living with gadolinium,
yeah,
it's
yeah.
just a Facebook page. 2019, not very many people were talking about gadolinium. There was about 1,200 people, and they were patients who finally got an FDA meeting and went, and those patients we owe a lot to. And a lot of them have since passed. A lot of them are still working on stuff. And yeah, but now we're from 1,200 in 2016 to 14, 15,000 now in one group, and then there's worldwide groups and there's crossover. But yeah, so we have to share the knowledge and we have to share the word and we have to help educate people for sure. So Living with Gadolinium is a Facebook group I just started to create awareness. We post research papers, we post patient stories. We just want people to really understand how horrible this is. It's, I mean, the largest growing age group in our community is from the age of like 25 to 44. And those people should be having families and children and buying homes and careers. And a lot of them were stellar students. I talked to college kids who should have been graduating from college and got poisoned for whatever reason, and now they can't work. Some of them are couch surfing from they're couch surfing from family member or friend member or what, because they can't work. And that's a devastating long-term impact to our economy, to our ability to create new things and live happy lives. And you know what I mean? You should be participating at that age. You shouldn't be laying in bed, couch surfing, having no money, having no insurance, having no job, having home and food instability. Those are all things that we need to look at. That's why this is a human crisis. This is a human crisis.
Well, I think that the listeners should understand that radiologists have no relationship with their patients.
Yeah,
And
okay.
if you have no relationship with a patient, you're a technician, not a physician. And
Okay.
these guys, I mean, they really should be horsewhipped, but they 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 float along as if they're not responsible. And
Well,
some of the other groups are a little stronger, although their corruption is rampant inside of medicine. And some of the other groups, they have leaders that might be be willing to drag all this stuff out. And but this is a huge revenue source for these jackals, and
and
they
I do think there are, to your point, the old dialogue, the dialogue that was around when I was poisoned was drink a lot of water, it'll be out of your system in 24 to 48 hours. And I still hear that dialogue from patients who join our group. They're still being told that. And that is no longer true. That is factual. That is not true. Water will not get this out of your body. So we have to stop that dialogue. And there are people that still promote that dialogue. So we have to get caught up in the current research. It's retained in everyone. It's problematic. We're seeing the things we talked about a little bit here. So let's all catch up,
I
right?
didn't start with this insight, but as I went through this material over about 25 hours of study. At the end of it, the light bulb popped above my head, and I realized that this stuff should never have been used. These people are psychopaths that they ever considered it, and that the evidence has been clear since 2018, even though it's much more clear now than it was then. So,
And to your point, the RACI chart, I always talk about the RACI chart, and a lot of people aren't familiar with the RACI chart, but I spent 32 years of my career in business. And the RACI chart is a business process that says who's responsible, who's accountable, who needs to be um, communicated to and informed. And when you have those processes in place, things go much better. And right now, to your point of the RACI chart is broken because you said it, no one ever follows up with the radiologist. And a lot of times now in MRI, I hear it from radiology technicians is they can be running 2 or 3 scans all at the same time, and they're remote, some of them. They're not even at the facility where these images is happening. And I would encourage patients to ask those questions. Is a radiologist on site? And it's changing. And you have to remember that imaging at is different at hospitals versus investors who are buying it for profit and opening these centers and the training that happens. And I mean, it's complex. It's complex. And we have to figure it out. And you're right, there has to be accountability, but a tech who's told to do their job, and then a tech who comes to our group and hears the stories and wants to quit their job because they realize that they're poisoning people with a toxic rare earth metal, it's devastating to them too, right? And we have doctors in our group who were doctors like you and worked their whole careers, and then they were poisoned because no one, even in their own industry, no one mentioned to them that what they knew. So
it
yeah,
was just another routine that they did all day.
yeah.
Well, Deb, I'm grateful for your time. Is there anything else we should bring up?
I don't know. I could talk about it forever. I have so many more details, and I appreciate your candor and your approach, and I appreciate that you respect mine, that I have to, I have a lot of data and I have a lot of talking points, and I welcome anyone to come. I will share everything I have. I've read thousands and thousands of hours of research papers, and I want to change the dialogue. And I've interviewed well over 1,000 patients, and every new patient is a heartbreaking story. No one deserves this. No one.
Okay. Well,
Thanks for having
okay.
me on.
All right. Thanks. And you're welcome to call me anytime.
All right. And we'll check out your products that you suggest, and we'll get information about that out there. Because,
Call David
yeah,
Kennedy and talk to him.
all right. Yeah, he's making the news, right? So I hope that they get that product. And I heard that the product was available and then it was pulled off the market,
No, it's not, it's
not for
available.
human.
It's available as a water purifier.
Yeah. Okay. Not
Jesus.
human consumption,
Yeah,
but
FDA has suppressed it. See, FDA has half their budget comes from directly from pharmaceutical company in the form of user fees during the
yeah.
patent process. So it's a very sick organization.
Yeah,
So
and I have those
industry,
numbers, and
yeah,
I've seen that data, and yeah, we need change there. And I hope that the changes that are happening continue. That
yeah. I mean, I trust RFK Jr. He's forced to go slow.
well, he has to, I mean, with every every win he makes, he gains trust.
Yeah.
And a lot of people don't trust the system anymore. And the pandemic's not over. I mean, people think the pandemic's over, but um, a lot of people, the protein spike, and I know they're coming up with cures for that too, but we got problems with our healthcare.
Okay, Deb, is
Okay,
great chatting.
thanks a lot. Take
Talk to you
care.
soon. Okay.
Bye. So I don't even know if you want to